Hi, how are you?
Hey, I'm good. How are you?
Good. My name is Amy, and I'm going to be doing an assessment on your infant today. Can you tell me how he's been eating?
He's been eating pretty good. He eats about every 2 to 3 hours.
Okay. Is it breast or bottle?
Formula, yeah, formula.
Okay. Well, that's about what we would recommend for this age and for bottle feeding. And can you tell me how he sleeps?
He sleeps okay. Every now and then he'll wake up at night for a bottle, but for the most part he sleeps through the night.
Okay, that sounds great. Is he sleeping in his bed or where is he sleeping at?
He does sleep in his bed on his back, but it is in my room.
Good. Because with the Back to Sleep campaign, we're wanting to make sure they're on their back so that we can try to prevent sudden infant death, which is SIDS, and that's great. You're doing exactly what you need to be doing. As far as milestones, there's things that I wanted to talk to you about, and this is going to be the 2-month milestones. And at this point in a newborn assessment or an infant assessment, I would start asking questions along the lines of what milestones the baby had met. This is a Centers for Disease Control CDC handout, and it's talking about the 2-month milestones, and this is a 2-month-old infant. So I would ask things of the mother like, does he smile at people? Does he smile at people?
Yes, he does.
And does he turn his head when someone comes in the door and speaks? Does he
yes.
acknowledge that? And there's other things on this particular sheet that I would be asking her as well for those milestones to check and make sure they're good. We're going to do a safety valve. Can you put him up on the exam table, please? And at this time, we definitely would not want we want to keep either you or me one within touching distance of him so he does not fall off of the exam table.
Okay.
The first thing that I'm going to assess is I'm going to assess his quiet things, and by that I mean the things that I need to assess while he's quiet. So his heart, his lung sounds, and his vital signs. I'll be doing that while I'm getting his vital signs. And I'm going to listen to his respirations in all of the quadrants. And while I'm doing that, I'm going to count his respirations for a full minute, because a newborn or an infant's respirations can be irregular, so you want to count for the full minute. And I'm going to check on his back in all 4 areas as well. And a newborn respiration, you would expect those to be, or an infant respiration, you would expect those to be between 30 and 60. I'm going to check his heart, and when I check his heart, I'm going to listen to the the aortic, the pulmonic, the mitral, and then the tricuspid valves. And you'll see that as I move my stethoscope. Normally, I would have a smaller stethoscope. So I'm going to listen to the aortic, pulmonic, mitral, and tricuspid valve. And then while I'm doing that, I can listen here at the apex, and I can count for another full minute as well and get the pulse, and the pulse should be somewhere between 100 and 160 for an infant. I'm going to also listen for any murmurs or any kind of odd heart sounds like that as well at this time. And I'm going to take a temperature on my infant. I'm going to take his temperature. And the temperature should be between 97.5 and 99.5. And then I'm going to take measurements on my infant. So I'm going to get his weight.
Okay.
And put him over here, supporting his head while I'm moving him. And I'm going to get his weight. I'm going to get it in pounds and in kilograms, and we're going to put that in the growth chart and let mom know that as well. And then we're going to assess his length. We're going to assess his length and his head circumference. And I'm going to do that in centimeters and in inches for the growth chart for centimeters and for mom for inches. I'm going to start at the top of his head. I'm going to measure to the bottom of his foot. And he is 21.5 inches, or right at 55 centimeters. And then I'm going to measure the circumference of his head, and he is 39.5 centimeters, and he is 15.5 inches. For that, we're going to put those in the growth chart. And with the growth chart, this is going to show us the general range for a baby, 50% being average. And we're going to check where he's at in percentage for that by matching this up. And we want to make sure that he is somewhere in that average range, and that also that he is following a curve. We're going to assess the general appearance next, and that includes his skin. We're going to assess him for symmetry, so symmetry of his limbs, making sure that they're the same length and that they seem to have the same amount of motion and all those kinds of things. We're also going to assess him for his skin color. I want him to be pink. I can look at his palms and make sure they're the same color as my palm, that they're pink like mine. I can look in his mouth and his lips and those areas and make sure those are pink as well. I'm going to assess for his alertness, and is he opening his eyes, looking at me, making sounds at me, things like that. And then I'm going to start assessing his chest. I'm going to look for respiratory effort. So for this, I'm going to look at his intercostal area, and that's going to be right here between his ribs. I'm going to look for retractions when he breathes. I'm going to look at the sternum as well for retractions when he breathes. And this would let me know if I saw those that he was having difficulty breathing. I'm going to also look at his breast development and nipple area to make sure that's well developed, well formed. Check the lymph nodes in that area as well. Then I'm going to check his abdomen, and while I'm doing that, I'm going to assess his bowel sounds. In all 4 quadrants, I'm going to assess his bowel sounds. Now, I'm going to inspect the area, and I'm going to look at the umbilicus, for example, and I see that this baby's umbilical area is poked out just a little bit, and that tells me he may have a little small umbilical hernia, and that may be something that I need to report to the doctor and that we need to keep an eye on to make sure that that doesn't need to be repaired. I'm going to feel for his femoral, let you see where I'm mashing, feel for his femoral pulse. I'm also going to feel in that area for his inguinal lymph nodes and make sure that none of those are enlarged. I'm going to put his diaper back on for right now. And then I'm going to start a more head-to-toe assessment. Now that I've gotten past those quiet points, I'm going to start a more head-to-toe assessment. And I'm going to look at the shape of his head. And I'm going to note, with a 2-month-old, the molding from birth should have left by this point because it should have been gone within a couple of days. But I am going to note and see if his head is nice and round. Because a baby that's been left on their back too long and hasn't gotten that nice tummy time may have a flattened area on their head or on the side of the back or the side of their head that we would need to educate the parents that they need to make sure they get their tummy time. Mom, is he getting his tummy time?
He doesn't like it, but he gets it.
Good. I'm also going to check the sutures, and I'm going to check the fontanelles. The posterior fontanelle closes about 2 months, which is about how old this baby is. So I may either not feel it or it may be very, very small. The anterior fontanelle should be still palpable. It should be flat. If it is bulging or hard, I would think that maybe he had some intracranial pressure issues that I needed to have dealt with, need to be reported. Or if it was depressed, I might think that he was dehydrated, and that also needs to be dealt with. The other things I'm going to do is I'm going to look at his face for symmetry, and that would indicate whether or not he had some nerve damage, maybe from birth, if the face was not symmetrical. And then I'm going to look at his eyes. I'm going to look at the shape of his eyes, because his eyes, if they are slanted much, and I look at the epicanthal folds, may indicate ethnicity, and that may be all it is, but it could also indicate something like trisomy 21, Down syndrome. I'm going to look at the color of his sclera and make sure that it is clear and white. If it was yellow, I would be concerned for bilirubin. I'm going to look to see if there's discharge in the eyes as well to check for possible infection. Then I'm going to look at his ears. And I want to make sure his ear is well formed. I also want to look on the line between his eye and his ear and make sure that his ear is at least as high as his eye. And then I'm going to look at the straight line, so make a straight line with that. And I want his ear to be straight with that line. If his ear is more at an angle, that can indicate congenital abnormalities, as can an ear that is too low. While I'm assessing in this area, his eyes and his ears, I want to get my ophthalmoscope, and I'm going to assess his red reflex. And just to make sure that the retinas of his eyes are functioning, I should see a red reflex on there. I'm going to assess his pupillary response and make sure his pupils are responding. I'm also going to, and if this baby was able to, he would give me a Moro reflex, which means that he would startle. And his arms, usually their arms will go up. Yes. So we are going to check his nose, though. We're going to check his nose for patency. So I'm going to look up his ears, make sure they're straight, and that there's no deviation. And then I'm going to push on one and see that he can breathe through the other, make sure there's no flaring of the nasal passages either, that his nose is not flaring. Flaring would indicate breathing difficulties. I want to make sure there's no discharge from the nose. On the mouth, as far as the mouth and throat, I'm going to look at the frenulum under the tongue and also under the lips to make sure that he's not having trouble sucking or he won't have trouble speaking. And then I'm going to feel the hard palate, or soft palate and hard palate area, and make sure that that does have the bone there and that it is hard there at the hard palate. And also that will elicit the sucking reflex, and that will check one of his neurological reflexes as well. And then I'm going to check his neck. Now, on an infant, I'm going to check for this age a tonic neck reflex. A lot of these reflexes don't disappear until 18 months of age, so he should have that. That means when he turns his head, automatically his arm will go out, and they kind of assume a fencing posture, so it's kind of like this. I'm going to palpate his neck and check for any lymph nodes or masses and his thyroid gland, and just make sure nothing is enlarged there. With extremities, I'm going to check his range of motion. I'm going to check for 5 fingers. I'm going to check to make sure that his capillary refill is good in his fingers. I'm going to check palmar grasp reflex. He should grab my fingers and sort of latch on. While he's latched onto my fingers, I'm going to pull him up just a little bit. And with a normal newborn, you would see that as you pull them up, their head will lag back, which is called head lag, and that just means their head just falls back just a little bit. So you gently want to do that. And then I'm going to support him back down. With his lower extremities, I check range of motion with those. I'm going to check alignment, so I'm going to straighten them out, make sure that the heels go to the same place, that the bend goes in the same place, that he has 10 toes, there's no webbing on his toes, and then I'm going to check for congenital hip dysplasia. I'll have to remove his little diaper to get his legs to do what I want him to do. And for this, I'm going to grasp and go outward with his hips to see if I hear a click, and then I'm going to move in and down to see if I can feel that hip joint moving backwards. It should not move backwards and out of joint at that point. Let's put his diaper back on. And I'm going to check the Babinski reflex on his feet. And with that, I'm going to run my finger up the bottom of his foot and his toes, because remember, he still has reflexes. His baby reflexes, his toes should flare out. Like that's what we would expect. I'm going to look in his diaper, and I'm going to check his genitalia, and for this I'm going to check the urethral position. So I want to make sure that the meatus is in the center of his penis, not to either side, and not above or below. It needs to be in the center. I'm going to check that there are rugae on the scrotum, because that indicates gestational age, that he's a term baby. And I'm going to feel and see if the testes are, the testes are not down and they don't come on down, then we need to let that be addressed by the doctor, because that may require surgery later on. The next thing is I'm going to look at his overall general muscle tone, and I'm going to check him for the doll's eye reflex, which means when I turn him to one side slowly, his eyes should come up, just like a doll's would. And so when I turn him back to this side, they should come up again. And then I'm going to check him for the stepping reflex as well, and I think we can take these off at this point. I'm going to check him for the stepping reflex, and I'm going to hold him up, and when you hold the baby up like this, it will take steps. And it will step, and that is a normal reflex. I'm going to look at his spine, and I'm going to feel down his spine and make sure it's straight, and then I feel all the bones. I'm going to look down at the base of his spine, and I should not see any tufts of hair. I should not see any dimpling or any holes in the bottom of his spine there at his buttocks. If his diaper was off, I would look at his gluteal folds and make sure that they were even. Any tufting of hair or dimpling of the spine, that would indicate a cold spina bifida, or the gluteal folds, if they were not even, that would indicate that he had congenital hip issues. At this point, I am ready to look with my otoscope and checking his ears. I've saved this for last because it'll make him cry, Mom. Okay. So I'm going to hold down and back on his ear, and I'm going to brace my hand against his head so it doesn't shove so I don't accidentally shove this down his ear if he moves. And I should see a pearly gray eardrum. And at this point, we are done, Mama.
He is upset.
And he is doing so good. Can you tell me, do you have any questions?
Yes, I know he's going to get several vaccinations within his first year. How can I be sure that I keep those on schedule?
Yes, actually, I have a handout for you on that. This is also from the Centers for Disease Control, CDC. And I'm telling you today that he got the hepatitis B vaccine. It's his second dose. Okay. Rotavirus, diphtheria, tetanus, and pertussis. The hip, he got the pneumococcal vaccine, and he got the polio vaccine. He's going to get all of those again at 4 months, except for the hepatitis B. He won't get that one again until around 6 months to 18 months, depending on the doctor. But here is his vaccine schedule. I'm going to give you that. Okay. I'm also going to give you a list of his 4-month milestones so that you can kind of be watching that. There's also in this packet, there is some things that you can be doing at home with him to sort of help him on his way to meet his milestones.
Okay.
Any more questions?
That's it.
Thank you so much.
Thank you.